fix full arch in the 21st century, how robotic assisted surgery is setting the standard. When I look at what is possible on an everyday level, it gives me pause. The incredible advancement underway is simply astounding on many levels. Hello everyone, I am Dr. Bruce Smoler, a second-generation dentist here in Westland, Michigan, located outside of Detroit. I am the founder of Smoler Smiles. I've been in practice placing implants for over 30 years. I've been a robotic implant surgeon for over 5 years. At the conclusion of this activity, we're going to look to have a better understanding of robotic technology. We're going to learn about the team approach, and we're going to review the robotic workflow and how it affects the clinical applications to grow your practice. Why YOMI? What is YOMI? Efficiency studies. So we'll go through the agenda step by step. I'd like to say if I can become skilled with the YOMI, anyone can. We had a milestone in October of 2025. Our associate, Dr. Mohi, became the youngest robotic implant dentist in the country at 26. We believe no one should suffer the ill effects of edentulosum. Our goal, our mission, is to make dentures obsolete. The technology and process we have developed is helping people live better using the best available technology in America today. After this program, you should be able to gain insights on the impact of haptic robotics on workflow efficiency for partial and full arch dental implant cases compared to freehand placement. Plus, you should be able to identify the key advantages of robotic guidance versus traditional static guides and freehand techniques. You should be able to evaluate clinical data on the surgical timing and efficiency for osteotomy and implant placement using robotics. Reading journal articles are certainly beneficial, but connecting the dots to see how the implementation of a particular paradigm shift can truly improve not only your patient care, but the overall condition and prosperity of your implant practice. So first, an overview. YOMI is a dental robotic assistant that helps me with efficiency, accuracy, and predictability. It is not your father's way of placing implants. You know, comparing when I started placing implants back in the 90s to what we do today, it's quite apropos to call the 1990s the Black and Decker days of implant dentistry. It is like putting wood screws into wood. Maybe that's why instructors talk about the density of wood when comparing the types of bone, D1, D2, and so on. YOMI is attached to the patient via a tracker arm. This allows for the movements of the patient to be accurately followed by YOMI. The handpiece is under my control. From the virtual plan, the YOMI is guided by me to follow the plan exactly. What's groundbreaking is the virtual plan can be easily modified. The term to define this action is called dynamic. The best part is the implant can only be placed where you have planned it to go. There is a physical limitation of the movement of the handpiece by the software to prevent any deviation from the virtual plan. This is the term haptic. When driving a car with lane assist, the vibration of the steering wheel or the vibration of your butt in the car seat is an example of haptic feedback. This is why the YOMI is the most accurate, precise way to place implants in America today. I didn't know much about the YOMI 5 years ago. However, I knew immediately back in 2020, YOMI would have a huge potential to help change lives. Sure, not everyone was on board with my decision to buy a robot during COVID. But hey, you only live once. But frankly, I was just blown away with the technology and the ability to change lives of so many people. To me, it was a transformational way to help people live better with robotics in the most unique and novel way. From there, we spent years developing a protocol to help make dentures obsolete. This is an example of the evolution of the robotic system from its inception. I will show a more interactive video and then touch on the comparison on the medical use cases. Just like other categories, Yomi uses a GPS-like system. That means you input your plan and the robot gives you a physical response when you're going off plan, even allowing for you to make accurate real-time adjustments in surgery that you can't do with any other treatment modality. Robotic technology has been integrated into medicine for decades, delivering millions of successful, predictable patient outcomes. From neurosurgery to orthopedics, robotics has enabled greater precision, consistency, and in minimally invasive approaches that have fundamentally elevated the standard of care. From head to toe, the impact has been undeniable. Now that same technological evolution is advancing into dentistry, bringing a new era of precision-guided, minimally invasive treatment with the potential to transform patient outcomes in our field. I originally chose robotics over guides and freehand because they had more predictable patient outcomes. They were minimally invasive procedures. They provided the quality of life for denture patients. More spectacularly, we developed ways to offer practically bloodless procedures. Man, talk about creating patient-friendly benefits. The only way to have a better patient benefit than bloodless would be if it were free. Back in 2020, no one I know was using the Yomi. But once onboarded, it didn't take long before I was placing implants with my right hand on the patient's right side, placing implants on their left side with my left hand. Sure, some docs like my father were ambidextrous, but I never imagined I could be as well. I knew that if I believed and was committed to the technology, it would not only accelerate my expertise and expand our implant patient care work volume, it would exponentially increase ways to help denture wearers live better. Through the years, I've been involved in many research studies and articles on robotics. The most recent one was based upon intraoperative efficiency of dental robotics. Here's the overview of the efficiency study. I wanted to be part of this study because I have seen the power of robotics. On average, the savings of time was tremendous for many of our cases. From the study, there was a 45% reduction in the time it took to prepare the site and place the implant for singles in partially edentulous patients. Moreover, for full arch, there was a 73% reduction in time with the robotic approach. Are you kidding me? That equates to 80 minutes. Here's the secret sauce. With robotics, for every other simple or complex cases, the time it takes to go from diagnosis of the case to placing the implant is fast, as well as having a fast surgery and getting the case finished. With guides, there is a wait to fabricate them from the time of diagnosis to surgery. This delay can range from at least an hour in advanced digital office to several weeks for most offices in most cases. We will discuss how guides are not always able to be used as intended, plus the accuracy is not always as desired. So, when problems occur, the risk of bailing on a guided surgery is greater than the need to bail on a robotic navigation case. These problems will result in delay of finishing a case. When looking at a freehand approach, the speed of diagnosis to surgery can be fast. Likewise, a proficient surgeon can be fast at placing implants. Accordingly, they can get to finals in straightforward cases with abundant bone quality. and do it quickly. However, in more complicated cases, such as an immediately placed implant or doing surgery in more compromised areas of barely sufficient bone or reduced visibility, or in cases near vital structures such as nerves and sinuses, most of those beneficial attributes are lost. The need to bring bone to do a bone graft and for an immediate extraction site due to the drills bouncing off the lingual plate or cortical bone is very common. Off-angle drilling and skiving of the implant upon placement is not uncommon. All these deleterious results can be obviated with the strongest arm in implant dentistry, the YOMI. Here is an example of a type of case we use in a multi-site clinical study. We compared traditional freehand implant placement with robotic assisted procedures for both partial and full mouth cases. Notice how we were able to immediately place an implant into the interradicular bone, ideally positioned without having to wait to scan the patient to send out for a static guide. As mentioned, the patient came in, we diagnosed the treatment, and were ready to get started within minutes. We compared the precision and efficiency of a full arch robotic surgery to a free-handed full arch surgery. Hands down, the robotic surgery was a lot more predictable, less invasive, and it had a higher level of patient comfort. The study showed the ability to reduce implant drilling times and placement by 73%. But wait, there's more. Not only did the study show how robotics significantly reduced osteotomy and implantation times, but it also improved workflow efficiency while maintaining high accuracy and precision. When I was doing surgeries freehand, I had to take multiple x-rays to verify the drill locations. Now, we do not have to stop to verify drill positioning or implant location during the surgery. Plus, how many times did you change the implant size when doing a surgery? Or the angulation of the implant changed from the original plan and you had to swap out components. All of these additional steps increase surgical time and decrease workflow efficiencies. The net result is we can perform implant surgeries with fewer disruptions to our workflow. This graph shows the adoption and high growth of implant placements. These robotic implant numbers will continue to climb at an increasing rate. There are more in-depth clinical studies recently published in JOMI by Dr. Jay Newgarden. This was on the precision and accuracy of robotics. This study compared the coronal depth, the deviation, as well as the angulation deviation and apical deviation. Robotics was clearly more accurate than freehand guides and navigation. I want to make sure everyone can gain some insights on how robotic implant systems can be integrated into a GP workflow to improve precision, reduce chair time, and enhance patient outcomes. Looking past the studies, robotic haptic guided implant placement will improve your practice and significantly improve the patient experience for the following reasons. Minimally invasive, expanded team approach is helpful. Everything about the YOMI workflow is designed to drive operatory efficiency. It's of note to say most people do not know what they do not know. Having an open mind becomes central to accepting a new paradigm of robotic implant placement. Increasing efficiency is possible by driving down treatment times and reducing the time to provide the service to almost instantaneously. This was an example of threading the needle for that molar implant placement in between the mesial and distal roots. A more accurate and precise drill sequence will limit post-op complications due to improved placement compared to off-axis drilling, freehand, which tends to expand the osteotomy, which can have a deleterious effect on outcomes. Most implant surgeons have experienced the less than ideal situation when an implant skids off the cortical bone and deflects to an unplanned position. Increased efficiency is also possible by reducing flap elevation, leading to less post-op discomfort. Many of these robotic guided surgeries can be done flapless, leading to virtually bloodless procedures. Once again, this saves time and drives efficiency if you do not even have to place sutures. Plus, a digital plan is created in the Yomi workstation. You can also upload any STL files of your planned post-op design, as well as importing photogrammetry information. There are options today for your patient's implant services. One thing to keep in mind, the internet and social media are the great voting machines. Patients are indeed looking for the most comfortable, predictable, and effective way of treatment. Robotic offices are out in front, attracting the early adopter patient. Us Yomites have a clear advantage in attracting patients seeking the highest level of care and technology. Looking back at our journey, to be here today, it was not the easiest nor the clearest, but to me and our patients, the journey was well worth the effort. This slide shows two of my favorite quotes. It took me 20 years to become an overnight success. Plus, as David Goggins says, I don't stop when I'm tired, I stop when I'm done. Conventionally speaking, there are 4 options to place implants: freehand, guided, navigation, and robotic. There are benefits to each option. A knowledgeable clinician should have at least a very cursory idea of these modalities. So let's dig a little deeper. Here's the skinny on the 3 non-robotic surgical placement options. Freehand has been done traditionally. There are no guides to fabricate, and the surgery can be same day when a patient shows up. So the speed from diagnosis to surgery is fast. However, the level of care and precision is highly operator dependent. Most freehand surgeries are more invasive surgeries due to the reflection needed to visualize the bone or vital structures. The ability to have precision and accuracy is highly operator dependent. Static guides is what most docs use today. They are printed with sleeves either in office or from a lab. These are teeth-borne and can be bone-borne as well. Stackable guides are advanced static guides with layers or interconnected parts, which allow for more control of the full arch process. Navigation is a dynamic system, which can be performed same day. There is the ability to change a digital workflow with interoperative changes. However, the results can be highly variable due to not having any haptic guidance. Plus, there can be some latency between the drilling and the tracking of the surgery. Robotic guidance in this country is only offered by the Yomi by Neosys. It consists of not only a dynamic approach, meaning the virtual plan can be changed intraoperatively, but it is haptic as well. Haptic robotic guidance is the whole new level of precision and accuracy. Haptic robotic guidance gives the surgeon feedback. It is a wild concept to only be able to place an implant to the exact digital plan. You are unable to veer away from the digital plan. With the other systems, you physically can have an oopsie moment. The non-robotic options can have an osteotomy placed too deep or too off axis or in an unplanned manner. The Yomi is the only haptic guided device in the market. It is precision control at its finest. Freehand placement proficiency is mandatory to be able to provide a high level of care. The reason for this is due to the variation of the freehand drill sequence, as well as the position of the osteotomy location can vary from the intended location. Plus, there can also be the angular deviation to consider as well. Implant placement is performed in three dimensions, the X, Y, and Z axis. Another main concern with freehand placement is the size of the flap reflection to visualize the vital structures. Patient discomfort and follow-up complications tend to increase with a larger flap and incision line. When comparing immediate placement after extractions, a freehand approach is more demanding. Muscle fatigue, increased surgical time can occur. Trying to press and guide the implant into the cortical bone without it bouncing off can be a challenge freehand. Here are just some of the complications or less than desired results of freehand surgeries. These can show up both as surgical and prosthetic problems. Static guides are the most widely used type of guides. In some surveys, more implants are placed with static guides versus freehands. These do tend to be more accurate than freehand in many cases. However, there are some drawbacks. The time it takes to create the guide can vary from an hour at the absolute soonest, or more likely days or weeks. There can be an added cost of treatment, especially at a lower volume, with outside labs fabricating the guides. Many advanced clinicians do not want to leave a critical aspect of the surgeries, designing the guide, to chance, and they do not want to lose control when outside labs are designing and fabricating the guide. The accuracy of the guide is dependent on several factors: who's guiding the guide, a tech with limited knowledge of prosthetic or surgical protocol, if the teeth holding the guide in place are not stable, fewer options are possible with a basic static guide. Older designs were not as effective with allowing for abundant cooling and irrigation and visibility. Based upon the system used, there can be more inaccuracy in the design of the guide, especially if you are doing immediate placement with the design and you have to guess where you want the implant placed relative to adjacent bony margins. Not all extractions are traumatic. And if you have a design based upon tooth removal, there are times you can get more bone removal than anticipated. There are the oops moments for anyone who has used static guides as well as stackable guides. They know there are several complications which can occur. Ask me how I know. Plus, when there are bone level guides, there is an algorithm used to help simulate the bone density. The bottom line is errors can happen, and when it does, can make your day excessively long and problematic. These are examples of some of the problems that happen. The increased need to have accuracy. There's limitations with these types of surgeries. You cannot make changes. There's there's a longer lead time, so it's very difficult to have same-day surgery. There's a cost of the guides, as mentioned, reduced visibility, and in some cases, compromised irrigation. Stackable guides have been a workhorse for some full arch offices. There are several brands on the market, Chrome and DX, as well as InSequence, and a host of other options are available today in the marketplace. The problems is that there's a lot of parts, pieces, layers, and stacks to keep track of. Sure, once proficient with 3 or 4 parts or pieces, it can become routine. However, the more steps and layers there can be, more induced errors. Plus, when paying for teeth along with the stackable guide, there's the potential for problems, which makes the permanent teeth not as accurate or simple as desired. Yep, sadly, these errors can happen more than the industry would like to admit. Basically, who's guiding the guides? For some stackable guides, there are more steps to get the bone-based guide to see. Fitting stabilizing pins in place can be difficult. Putting the stacks in place after the bone reduction can be challenging as well. Typically, these guides require more, not less flap elevation. As we all know, the manipulation of the tissue can be a direct determinant of how much discomfort, swelling, and bruising to anticipate. But overwhelmingly, for offices using more than 5 to 8 stackable guides a month, the cost of leveling up to using the Yomi is quite literally a no-brainer. The lab fee for all these guides can be way more than the monthly fee for a Yomi. With any static guide for single teeth or full arch, the one most important caveat is how the mouth looks once the teeth are removed. Does the treatment plan change? Does the virtual implant placement need to be adjusted or modified due to removing supporting bone from an extraction site where you're planning to place an implant? Here was my case from years ago for a stackable guide. The anterior teeth were extracted and the facial bone was only partially intact. At the time, our lab was responsible for going over the virtual plan, but the time of surgery we had to improvise, rendering the guide barely salvageable. Navigation for dental implants offers benefits with accuracy and visualization, but is limited by a learning curve based on experience and skill of the surgeon, requires a lot of line of sight between the patient and the cameras. Surgeon must look on screen at all times, eyes away from the patient, not haptic, it's only dynamic. Those are just some of the main differences with navigation. Benefits of robotics in dental procedures. There's the efficiency, as we've mentioned, shortened procedure times through automation, increased accuracy, leading to a high precision in the placement of the implants. There's consistency because you have the standardization of the procedures, leading to more reliable outcomes. Here's the workflow for robotic guidance. Not too complicated. Plus, many, if not most of these steps can be delegated to your robotic team. By elevating your clinical team with more robotic related activities, their sense of pride is elevated as well. For workflow improvements, remember one mantra: slow is smooth and smooth is fast. Streamlining procedures can aid in optimizing surgical workflows, and enhanced protocols can reduce errors. Virtual planning is centralized in the Yomi plan. The software is very intuitive. Plus, Neosis, the Yomi folks, is a company run by a bunch of tech nerds and biomedical engineers. This means the service, the robot performance, future upgrades, and developments are central to their core beliefs. Don't be like Sisyphus. You do not need to make it any harder or more complicated than it should be. So, by empowering your team, they all have a hand in making the clinical workflow fit your existing system very easily. For us, the Yomi is the centerpiece of our office. We tend to celebrate our wins. This helps the team adopt the new workflow and systems to make implementing new technology easy. For my time to be reduced as much as possible, strategies were put in place to help our team level up their game. The ability to control almost all aspect of implant navigation. This is truly the most remarkable piece of technology in the dental world as we know it. Here's the biggest nugget of the program. Get ready, here it comes. One surgery is a traditional technique where a full thickness flap is raised. The palatal tissue is sutured out of the way, and then you can begin your surgery. If it includes transsinus implants, many clinicians will open up the sinus and make sure the implant is placed where desired. The other surgery will be more unique and outside the box. Here's the traditional surgery. Many docs are aware what full mouth implant reconstruction typically consists of. With a freehand or stackable approach, it can be pretty invasive. Cutting of the gums with or without leveling of the bone, tying back the tissue for direct visualization, taking care of any bleeders in the tissue or the bone, the need to locate the various vital structures, drawing on the bone with a pencil to help highlight the anatomy, plus how many x-rays do you need to know if you have placed the implant deeper or not into the sinus. These steps are part of the reason a freehand approach can take more surgical time for most, if not all, full arch traditional surgeries. Let's reimagine treatment, highlighting our trademark process, what we call the Smoler Express for denture wearers. Minimal bone is present on her upper, making a more involved surgery to place transsinus implants up to the piriform rim. Plus, with barely adequate bone on her lower, it may make treatment more challenging for most clinicians. Well, nowadays we simply say, hold my beer. Imagine if you could treatment plan and design her case to be like this. Develop solid initial implant stability, have adequate AP spread, allow a unique way for denture wearers to ditch their dentures in a novel, unique protocol. Here she is right before surgery. It's taken us years to perfect all aspects of this process to allow us to help so many denture wearers change their lives. This is right after Michelle's surgery, 5 implants, 5 MUAs, and she is ready for the digital workflow. Here's her lower arch. Right after her surgery with the white caps in place for her tissue scan. Many colleagues are blown away with the process we developed to help denture wearers live better. In the time it takes most surgeons to suture a full arch flap closed, we have already finished a full arch of surgery, and in some cases, a dual arch is completed in less time than to just close an arch of surgery. The traditional program for denture wearers has become transformational. It has taken us years to fine-tune this program and help denture wearers live better. No sutures, no incisions, no peeling back of the gums, with more precision and accuracy. It truly is remarkable what can be done when you combine a guided approach with the digital workflow. And for just completeness of her treatment, here are her final zirconia bridges. When we have developed the most efficient intra-op protocols for the Smoler Express, it's hard to imagine going from the analog days of a more invasive, bloody, and painful options. From a purely workflow process, imagine what it's like when you are firing on all cylinders from soup to nuts to help these patients find a more affordable, easier, and more comfortable process. And to be able to provide this service in less time than it takes to place sutures is remarkable. So let's look at another case. This particular patient had severe problems where she was denied lower implant surgery for many years. She had minimal bone height on her lower, and what we were able to do was at one time, without stitches, incisions, or peeling back of the gums, be able to convert a denture into a fixed lower bridge. Here are her case as far as the clinical images showing a smart on X or smart denture conversion for her lower arch. Once again, this is very common, what we're able to do on a regular basis. Patient comes in, no stitches, no incisions, no peeling back of the gums. We're able to place implants in a straightforward approach and be able to convert a patient with dentures not being able to chew, feel good, or live their life to the fullest in a matter of minutes. This happens on a regular basis where patients come in with a denture or partial dentures and are looking for solutions. This particular patient was interested in the simplest, straightforward approach. When we first got started, we had outlined other services on the top as far as aiding more support for her upper final bridge. It was elected to just do your typical all-on-4 approach on top and the bottom. What we're able to do nowadays is even expand the services to include additional areas of support, be it with pterygoid or transsinus implants. This is a simple thing where we can now add pterygoid implant support to cases for added support and security for our patients. No sutures, no incisions. It's been a blessing for our patients. When we start looking at ways that we can take a patient with a previous snap fit denture and easily convert it to a fixed prosthesis. In this particular situation, the patient had a pre-existing snap fit denture, and we were able to attach the yomi after treatment planning, a way to add more support, increase her AP spread, and it was absolutely incredible to be able to place implants in a very predictable, straightforward manner with no stitches, no incisions, no peeling back of the gums, and it is absolutely an amazing result for our patients who wanted a change from a snap fit denture that was causing more maintenance and long-term instability issues compared to our desire for a fixed full arch. Let's walk through a clinical case of a lower FP1 where we're able to align the implants basically parallel. Lots of issues going on with her lower jaw. We wanted to have a nice FP1 design and result. Minimal bone loss and ideally as parallel as possible to work around the areas of bone infections or bombed out areas on her lower left as well as on the lower right. We were able to place our digital breadcrumbs in place. We removed the teeth. We did level some bone in some areas. We did attach the yomi link bone. That's the connector that attaches the patient to the robot. So as she moves her lower jaw, the tracker arm moves accordingly so that we can precisely track the position and the placement of the implants in following the virtual plan. This is what attaches the patient to the tracker arm of the yomi. This is the fiducial marker attachment we use for the day of scan. One huge benefit of haptic dynamic guidance is the ability to modify the plan. We can automatically set the implants up parallel to each other. We can once again change the plan when any clinical conditions dictate the need to shift the implant location. We did just that for tooth number 21. Same opportunity to place the implant in solid bone while threading the needle on the fly with dynamic haptic guidance. Truly remarkable for tooth number 30. Here's the movement of the implant in a better location. And here we can see exactly how we're able to thread the implants from our digital plan around and near implants to a higher, more predictable level. So when you see 6 parallel implants in a highly successful location with very good initial implant stability, we can routinely place implants within millimeters of vital structures. And speaking of the inviolate 3 millimeter rule, where did dogma come from? I bet whoever said that surely did not have a Yomi. We often can place our implants millimeters away from vital structures with no harmful effect. Makes you wonder what a new paradigm can offer. The post-op surgical Panorex shows the implants in a parallel position. The result was exactly as we had planned, where to place the implants. Reduce the guesswork, reduce both mental as well as physical fatigue. The years of placing free-handed implants can and do take its toll on the body. Thank you, Yomi, for reducing my chiropractic bills. Here's the axial view of the case showing practically ideal position. This is the action picture of the case being guided into position. The tactile sense to move the handpiece effortlessly into the desired location becomes second nature. Close up of the converging deviation of the handpiece until it is in the right position as needed. The handpiece cannot move off axis once it is locked into the exact digital plan. This is a complete change from any other system on the market today. The simplest thing for me when I'm doing the surgery is try to close that angle so that from a deviation of where the handpiece needs to be to where it's at should go to 0. So it becomes like a ballet where I'm able to move the handpiece in graceful movements to easily, predictably go from the digital work plan where we precisely place the implants to actually making it happen intraoperatively. And here's the printed prototype delivered the same day. So we like to imagine what if. What if we had the optimal day and what we wanted to do to see what was possible? This happened to us back in October 17th in 2022. We had a husband and wife drive in from Fort Wayne, Indiana. They spent 2.5 hours with my sales team. I came in and blessed the case, and the wife asked how soon we could start. We drove in from Fort Wayne, Indiana, so as we are used to saying in the office, the speed and delivery of goods and services should be as close to instantaneous as possible. So we added not one, but 4 arches into a schedule of 17 existing patients. Sure, we did have to stay a little bit late, but unbelievable as far as the ability to help more people live better. Here's something to ponder. We look at human potential. We start to look at what's possible not only to help our patients live better, but also cases that we are not able to help in the past. Think of all the limitations we'd have to accept in the past, whether it was because of our clinical abilities were incomplete, whether the patients were unaware of how these procedures could be done in a very effortless, comfortable manner. So I challenge my colleagues to let go of the dogma. Make your mind your friend, not your enemy. The world of helping people live better is truly without limits. Here is how to reach me, Dr. Bruce at smolersmiles.com, or on WhatsApp, Facebook, LinkedIn, or Instagram. Thank you for your time.